What are the steps involved in administering a tuberculin skin test? Have you ever wondered how a tuberculin skin test is performed? This test, also known as the Mantoux test, is crucial for detecting latent tuberculosis infection. Let's walk through the steps involved in administering this important test. First, preparation is key. The healthcare provider will use a purified protein derivative tuberculin solution, which contains proteins from the tuberculosis bacterium. It is essential to ensure that the patient's forearm skin is clean and free from any lesions or scars where the test will be given. Next comes the injection technique. The test is administered intradermally, meaning the tuberculin is injected just beneath the skin's surface. The provider will typically use a small gauge needle, usually a 27 gauge, and draw up 0.1 milliliters of the tuberculin solution. The needle is inserted bevel up at a 5 to 15 degree angle into the inner surface of the forearm, about 2 to 4 inches below the elbow. The solution is injected slowly, forming a small, pale elevation or wheal on the skin that measures about 6 to 10 millimeters in diameter. It is important to avoid injecting too deeply or too superficially, as this can affect the accuracy of the test. After the injection, post-injection care is crucial. The provider will not cover the test site with a bandage or tape. Patients are advised not to scratch, rub, or disturb the area. They should return within 48 to 72 hours for the test reading. Reading the test is the next step. A trained healthcare professional must read the test results between 48 and 72 hours after administration. Using a ruler or caliper, they will measure only the induration, which is the raised, hardened area across the forearm, not the surrounding redness. The size of the induration is recorded in millimeters, and the result is interpreted based on the size of the induration and the patient's risk factors for tuberculosis infection. Lastly, follow-up is essential. Patients with positive test results may need further evaluation, including chest X-rays and clinical assessments, to distinguish between latent tuberculosis infection and active tuberculosis disease. Negative results in high-risk individuals may require repeat testing or alternative diagnostic methods. These steps are aligned with established medical guidelines, ensuring that the tuberculin skin test is administered and interpreted correctly. This process is vital for tuberculosis infection control and prevention. Always consult a healthcare professional for personalized advice regarding testing and interpretation tailored to individual circumstances.